Assalamualaikum all. So we completed 7 cranial nerves. What we are left with is 8, 9, 10, 11 and 12. So we will be covering it today. We'll start with 8th cranial nerve. It's called vestibulocochlear nerve. It has two functions. One is hearing, which is done by cochlear part, and the second is vestibular part that deals with the balance. So a cochlear part that deals with hearing, how do we examine? There are two simple methods. One, we just rub the finger, just like this. If you can see, rub the finger against the ear, and one by one, each side, both of them. And we ask the patient if they can hear it, or is there any difference between the two ears. So we can do it together, or we can do it separately, one at a time. And we ask the patient if he can hear this noise of rubbing finger, and if he's hearing, is there any difference. If he's not hearing it or there is difference, we proceed forward towards the tuning fork test, that's called Rennie's test and Weber's test. So I would like to show you a video. Is this video playing on your side?
Hello, Abby. My name's Amy. Please may I examine? Yes.
Stand behind the patient for the whispered voice test.
I'm going to whisper in your ear. Please can you repeat after me what I say?
Mask hearing in the contralateral ear by rubbing the tragus. Use a variety of numbers and letters and perform the test in a quiet room.
I'm going to do the same in your left ear.
Start at about 15 centimeters. Hearing a whisper at 60 centimeters approximates to unimpaired hearing. Hearing loss should be formally measured with audiometry. Use a tuning fork to help differentiate conductive from sensory neural hearing loss. First, Rennie's test.
Can you hear this? Yes. Tell me when you hear it stop.
The base of the vibrating tuning fork is gently pressed against the mastoid process.
Can you still hear it? Yes.
This demonstrated that air conduction is better than bone conduction, which is normal. Air conduction relies on the function of the outer and middle ear.
Again, can you hear this? Yes. Tell me when you hear it stop.
If sound transmission through bone is greater than that through air, then the test is said to be negative. This indicates conductive deafness. For Weber's test, place the fork in the midline.
Does this sound louder in either ear?
Normally, the sound is described in the middle and heard equally in both ears. Interpretation of both tuning fork tests is more subtle than it initially appears. The Dix-Hallpike maneuver can elicit positional vertigo due to vestibular disease. This vigorous maneuver is not suitable for all patients. When the patient lies back, the head should overhang the edge.
I'm going to lie you down rapidly and turn your head to the side. Please could you look straight into my eyes?
The patient's head should extend 30 degrees beyond horizontal and rotate 45 degrees to one side.
Do you feel dizzy or sick? No.
Watch the eyes carefully for nystagmus. It may take 20 seconds for this or symptoms to occur. The pattern of response can differentiate between a lesion in the inner ear or central nervous system. Repeat the test, turning the head to the other side.
Okay. Simple.
So you can whisper, or you can just rub. Simple method is to rub the finger, and then you go for the Rennes and Weber test. You saw the method how Rennes is performed and Weber is performed. We actually hit the tuning fork and then put it on the bone whenever, and ask the patient, as soon as the sound disappears, patient has to tell. When the sound disappears, we put this tuning fork over the ear and ask the patient if the patient can hear it or not. So this means that if patient is hearing after replacing the tuning fork from bone to ear, that means that this is normal. Normally, air conduction is better than bone conduction, and if it's reversed, if patient is not hearing during this air, when we put the tuning fork over the ear, that means that there is defect in air conduction, and bone conduction is better than air conduction. That is abnormal. So we go further for the Weber's test, and then we can go for the audiometry. You also saw the other part, that is the Hallpike's maneuver, which is done for the vestibular part of the cranial nerve, eighth cranial nerve. We usually don't perform this test in every patient. We only perform this test in patients who come with symptoms of vertigo or vomiting together. So after that, we have ninth and 10th cranial nerves. These basically supply the motor system in uh, pharynx and larynx, and the sensory supply of the posterior 1/3 of the tongue, and the sensory supply of the pharynx and larynx. This is these are very mixed together nerves, and the motor function of these tests is to movement of the palate and swallowing, voice production, cough and gag reflex. So we check separately all these different maneuvers. For example, for palate elevation, we ask the patient to open the mouth and say ah, and we look towards the uvula. If the uvula elevation is symmetrical, it's centrally elevating, that is the palate elevation is normal. But if the uvula is deviated to one side, then, then this means that there is a defect on the opposite side of the ninth and 10th cranial nerve. And we ask the patient to drink or some sips of water. If patient is coughing, then we say that there is abnormal swallowing. We check the patient's voice by simply talking to the patient, or we can ask the patient to say E, A, O, these three words, so that we can see where is the defect. So voice is formed by larynx, pharynx, and tongue, and finally the lips. So we can check all these three by by asking the patient to say E, A, and O, and we ask the patient to cough, so that if the sound, we see the sound of the cough. In laryngeal or in the 10th vagus nerve defect, there is feeble cough because of the impaired vocal cord contraction. And finally, we check the gag reflex. This is again a difficult reflex to check because it's uncomfortable for patient. We ask the patient to just open the mouth, and we touch the posterior pharynx or the tonsils with the tongue depressor, and see the gag reflex. So this is how we see palate. We ask the patient to just open the mouth, and we ask the patient to say ah. So this 11th cranial nerve is called spinal accessory nerve. This is pure motor nerve which supplies two muscles that are trapezius and sternocleidomastoid. We How do we check it? So we check these both muscles separately. For trapezius, we ask the patient to push the head back against the resistance. So we ask the patient to, we put the hand over the back, and we ask the patient to push at the hand. So we can check the power of the muscle. And second maneuver is that we ask the patient to shrug their shoulders like this, and we push the shoulders downward to check the muscle power. So this is for trapezius, and for sternocleidomastoid, we place the hand over the lower face and have the patient to ask the patient to rotate the head towards that side. So we put the hand over here and we ask the patient to rotate, and we check. By this, we are checking over the left side, because left sternocleidomastoid. If the patient is looking towards right, the left sternocleidoid muscle is functioning, and if it's impaired, we say it's left accessory nerve is damaged. So we check on the both sides. We can check muscle bulk as well for the sternocleidomastoid. I'd like to show you video for the examination.
Good grammar and spelling are important, but if you want to write essays that inspire,
Start with the glossopharyngeal and vagus nerves.
Could you cough for me, please?
An effective cough requires vagus nerve control of the vocal cords, as does producing a note.
Open your mouth for me, please. And say ah.
Look at the movements of the palate and uvula using a torch. If the palate is weak, you may be able to make air escape through the nose.
You blow out your cheeks for me, please. I'm just going to try and squeeze them in.
Consider using the water swallow test in fully conscious patients before moving on to the accessory nerve. Inspect and then palpate the sternocleidomastoid muscles, looking for wasting or hypertrophy.
And can you look over your right shoulder for me, please? And over your left shoulder.
Carefully resisting the movement with your hand.
Swing your legs over the side of the bed.
From behind the patient, inspect and palpate the trapezius muscle, looking for wasting or asymmetry.
I'm now going to feel your shoulders. Shrug your shoulders up and stop me from pushing them down.
Again, test power against resistance.
And pop your legs back up.
Next, examine the hypoglossal or 12th cranial nerve.
Can you just open your mouth for me, please?
Look at the tongue at rest for wasting, fasciculation, or involuntary movement. Use a torch if necessary.
And stick your tongue out.
Look for deviation or involuntary movement.
And move it from side to side.
Demonstrating active movements.
Pop your tongue back in and press it against your cheek. Stop me from pushing it in.
To test power in the tongue muscles.
And the same on the other side.
Then test lingual speech.
And now say, yellow lorry.
yellow lorry.
The swallow test is also relevant.
You know what it feels like. You've been studying hard in med school.
So with this, we have completed our cranial nerve examination. If you have any question or any confusion, you can ask me anytime. And I wish you best of luck.